I am Dr. Kristi Maas. I am a physician at Reproductive Care Center. We have branches in Clearfield, Utah and in Sandy, Utah, but provide care to patients throughout the Rocky Mountain areas, back to my home area. I'm here with Karlie and Zac Baxter today. They are the couple that won the Maybe Baby contest through 97.1 ZHT. And we're here to tell you a little bit about their story and their journey. And honestly, we just want to advocate for patients to be aware, to ask for help, to share your story.
I am Zach, and this is my wife, Karlie. And we are super fortunate to even be having this conversation. But yeah, we were able to win the Maybe Baby contest with RCC, and we've been trying to get pregnant for 2 or 3 years and
3.5 years.
3.5 years. And we just are just so lucky.
I'll talk a little bit about how I first got to know the two of you, and it was really via your amazing group of friends, your support system. And I remember watching the video and just being very touched by how hard they'd worked, how complimentary they were of you. And clearly they'd put a lot of time and effort into putting this video together, in expressing how amazing the two of you are and how wonderful of parents you are. Definitely got a little misty watching that, and just really was touched and wanted to be able to help you get to that journey. And you guys are just amazing people. You have a wonderful group of friends with you. And tell me a little bit more about where you are and your friends and everything else.
It's just mind blowing when they came over and they surprised us with the video. We had no idea. They were like, "Oh yeah, we're coming over," and all of a sudden it was like 10 of them, and we were like, "What is going on?" And they showed us the video, and we were just so surprised.
They had talked to us even before then because they were aware of our journey with infertility, and they would ask us many times, like, what can we do to help? Of course, we were trying to be gracious, but trying to control expectations. Like, we didn't expect them to do more than what great friends and family do to support you, in a lot of different ways. So when they kind of presented this video and it had already been submitted and we were all of a sudden like in the running for this opportunity, they were just smarter than we were, I guess, about how to do that. And it was so incredible for them to do that. I think we feel so fortunate and blessed, like, and just humbled by the fact that these people and then the community outside of them who participated in helping us have this opportunity. It was just incredible to see how many people were invested in and cared about us.
Also, extra nice that you're sharing this, right? You're here with us, you're sharing your journey as well.
Yeah, and it's even fun. Like now, I mean, we're 21 weeks pregnant, and we still have people come up to us. Like my sister will have coworkers who we have just met, and they're like, "Oh yeah, I remember. I actually voted for you guys," and we're like, "That is so fun!" Like that. These people that we had never met were supporting and cheering us on. So
I think it just speaks to how incredible the two of you are, how your love is, how your bond is, and how awesome this baby's life is going to be coming into the world, having you as kind of its foundation and launching pad for the future. You have a very, very lucky baby coming into the world. Didn't kind of know what you were being signed up for because you didn't sign on the dotted line. Was it worse than you would have thought? Was it better than you would have thought? Tell me kind of how was it? Because you were incredibly gracious through all of this, but really a lot of it was put on you without knowing.
I think so. The elements that were hard, I think, was the fact that we saw other people's journeys. We all wanted the same thing. What we wanted in our journey, it's not unfortunately unique to a lot of different people out there. And so that was hard to kind of see all these other people that you wanted to root for as well. And their stories were amazing. So I think that was probably a challenge. I think we had many conversations and probably still do about wanting to continue to give back to that community in some way and facilitate more of these opportunities happening with people. But like you said, we didn't know exactly what to expect from the experience. We knew a little bit about it from friends who had gone through a similar process, just with IVF. Yeah. But again, to have it also connected to 97.1 and the radio and hearing about it and then going on the radio, it was just like, whoa, what is going on? It's crazy.
Yeah, those weeks like leading up and trying to get votes was just so crazy, and just constantly checking and like all your friends rallying around you and just being like, vote, vote, vote. And you're just like, oh my gosh, it's all I can think about trying to like work and just do life when you're just wanting something so bad. It just takes over everything. We're obviously so elated, but then you also have those feelings for those other couples who wanted it just as much. And I remember afterwards, sometimes I'd like creep on Instagram and see if I could find them and see how they're doing. And some of them got pregnant. And so that was awesome.
They did research looking at couples or individuals that have full infertility benefits, meaning like you're not paying anything out of pocket. And there's a significant percent of patients that drop out of treatment after one failed cycle because of the emotional burden of it. And you're describing that perfectly in your own words and your own experience, that it's just like, oh my goodness, why, like, we're being aggressive. We did the thing, like we upped the ante, like we were even ahead of the curve. Why didn't this work? And I think part of that is how we're taught in our like most basic sex ed, like don't even look at someone with the opposite gamete or you're going to create a pregnancy across the room.
It's like, true.
Actually, at best, it's 22% chance per month. And then if we're doing things like medications and insemination, maybe like 10 to 15. But like we're really inefficient as humans. We suck at reproducing. We're terrible at it. Part of the reason, at least from what I've seen with patients, why people feel like such failures.
I don't think anyone gets to the point of wanting to try for a family and thinking that they're going to have any issue with it. Mm-hmm. And then when they arise, you're just a little bit unprepared. And then when you start taking those steps, like getting on Clomid and then doing IUIs and going through all these tests, and you don't get definitive answers, it's just kind of like, this stinks.
And you're paying attention to the 22%ers, like the people right. who are, having some pretty predictable success, which is, that's a whole nother journey that I think it was challenging for us. Is at first it was hard to celebrate other people's successes, being totally honest, and I remember like we both were just like, we hated that we felt that way, that like we didn't feel like to jump for joy when we had family or friends get pregnant
at the same time.
Yeah.
From my perspective, you're out there helping people because 1 in 8 struggle with infertility. And it's kind of this silent disease that people struggle with, that they kind of struggle with at home behind closed doors. You were very, very open with your nice, awesome friend network and your families. And that's part of what facilitated where you are now, because you were able to be open. And I think you sharing your story is allowing other people to realize it's okay. And not only is it okay, but you get the support and you sometimes win a radio contest and get treatment from that as well. So I just really appreciate your willingness to share that journey, because I think it's really important for those that are struggling, that may not have had their videos online, that may have been too uncomfortable to share that, because not everybody feels as open.
That's really insightful. And I think we definitely hope that if there's somebody who's like suffering silently in a way, like with this burden and the expectation that they might have and the hopes that they have, like, yes, we're very familiar with that, and would hope that anybody would reach out to whoever their support system might be, or, or us, I don't know, but like, just because it's such a common feeling, like everybody, most people really, really want to start their family. When there are obstacles in the way, it's a hard thing to deal with. And we initially were just really kind of perplexed at why it wasn't working when we had people who it seemed to be so effortless.
Like on the opposite side, I feel like it has opened up a lot of like friendships and conversations with people who are also struggling. It made me realize, like, yes, it's 1 in 8, but you don't realize how small it almost feels like once you're open about it, because people just come out of the woodworks and people just want someone to talk to. And when they're also going through it, it's easy to connect with. So I feel like we've been able to make a lot of friends through that in a weird way.
I mean, there's great resources here, but again, a lot of people, I've had patients be like, yeah, so I was sitting in the waiting room and one of my friends like walked and sat next to me and I had no idea and she had no idea. And like, here we
That
are
happened
sitting
to
next to
me.
each other, right?
Yeah.
And it's so strange, but that's kind of the unfortunate factor of infertility or multiple miscarriages or just kind of everything that happens within our doors. Can you talk a little bit about how long you were trying before you started to think about getting any type of support or help, or really what was the impetus for you to do so when you did?
Yeah, so we actually went to another local fertility clinic here in Utah 10 months into trying. And we started with just getting genetic testing done on both Zach and I, because a friend of ours was like, there might be something contributing in that way. So we wanted to rule that out, and nothing, we didn't have anything. So then we went the IUI route, and we did 2 IUIs then before our friends did the radio contest.
When we did go the IUI route, I remember the fact that it didn't work was actually really demoralizing for us. We were kind of trying to be as aggressive as possible. We were somewhat earlier on in the journey, but we're willing to start taking as many opportunities as we could. And I just remember kind of feeling all like the expectation and anxiety as we were trying to have the IUI be successful. And then when it wasn't successful and we still didn't have any clear cut explanation as to like what might have been failing or anything like that, we like mentally and emotionally were already starting to get kind of tired, and got to the point to where after the failed IUIs we were like, we need to just take a break. Like, sure, like, we'll try, we're not going to try to stop anything, but like I don't think we didn't have like the emotional or mental energy to like mindfully pursue it. We're like, let's just let it happen. And that was a part of like us leading into the opportunity you guys, and the timing was almost perfect because I think it was because it was with our friends when we were telling them like, I think we're going to really start to look into what we can do, what the next steps or opportunities might be. And it was right when the opportunity came around, and right when they decided to help us. And it was perfect timing where we were like mentally and emotionally ready to go for it again and see if we could be successful.
How about the diagnosis of unexplained infertility? Was it nice to have a diagnosis, or was that very unsatisfying for you?
Because there's so many people who come up to you and like implying like whose fault is it, and that's just how it is. It just is what it is. They're not really trying to be that way, but it's kind of nice to be like, I don't know. It could be either one of us. We don't really know. But then there's that other side, because when you have unexplained infertility, you're like, well, I don't know what steps to take or what route to go on, or what to exactly be researching to see if there's anything on my end that I can be doing to try and help. So you're kind of in this like helpless spot.
I think we were fortunate in that like we had unexplained infertility, but we still had indicators that showed that it could still happen. Because I think for others, like maybe when it's a clear cut thing, like your options are this or that because like one of you is just not able to help make this happen. I think that's probably helpful to have more emotional closure of like, I don't have to like fight this anymore.
Yeah.
Whereas, we were partly like, okay, so there's still a chance, but if it ends up still not working out, like then we'll end up having a mystery all the way. Like, and that you kind of grapple with that mentally as well.
I think unexplained is often hard because people are like, well, but why? And I'm like, I can't give you an answer. I'm unsatisfied as well. But 25% of people, up to 25%, will have that unexplained infertility. And this means that my tests haven't yet evolved to the reason behind everybody's infertility. And the good news is there's good treatment. The bad news is you need treatment. So you came to me, we did IVF, but that wasn't like the first thing in the door. It wasn't like, oh, hi, welcome to the fertility office, let's do IVF. There's a whole multitude of layers before that. And actually after that too, I know you talked about there's some stress that like IVF is it. If this doesn't work, what do I do? We can get almost anybody pregnant. Now the caveat is where your line in the sand is. Some people's line in the sand is like, you know what, I won't use a donated egg. And so that's a limitation. Or, hey, I won't use a gestational carrier. That's a limitation. But if you're open to all options, we can almost always achieve a pregnancy and a live birth for people. It's just really tailoring these things to comfort level. I think the other important components, and I don't even know if you guys remember having this discussion, but it's one of my very first questions that I asked you, which was, what are your family goals? And when we tailor treatment, we tailor that to a goal to achieve that ultimate family size. So if we're trying to like get someone pregnant for baby 1 or baby 2 and they're 40 and they want 6 children, we got to think about things that are fertility preservation. The nice thing is you were young, so we had time and flexibility. You, I'm so grateful, trusted me. You trusted the process. We worked together to figure out what really worked well for you, kind of got you through treatment. How about the actual treatment portion? Did you think that was worse than expected, or did you even have expectations?
I full on expected it to be this like traumatic experience. And I feel like with IVF, it's because it's kind of like that last almost resort that you put a lot of like hope into it. So I think emotionally it's a little bit more wearing, but like with IUIs, it's that first step. So I feel like you're almost coming in with all this like hope and thinking, oh, it's not this big of a deal. This is all I need. And then once you realize, oh, I actually need more than IUI, I need to do the IVF route. It almost is like kind of a relief because you're like, this is all I have, at least for us. So I felt like it wasn't bad.
I think that it's true. Like you felt a little bit of pressure because you're like, man, if this doesn't work, then what are we going to do?
Right.
And we have friends who've struggled even after they've gotten to this point. So I think we were cautiously optimistic, but I think also it was really exciting because we were going to try it. We were going to see if this could work out for us because there's also the stories of people where it was successful. It's still a relatively new treatment, a relatively new thing. Like the earliest IVF baby is like only 30 or 40, I think, or
She's like
something.
40. Yeah, she's in
Yeah,
her 40s now.
like I think about the generations of people who have wanted to have kids, and it's just like to be alive now is such an amazing thing. And so there's also that part where we're kind of willing to take whatever lumps are coming because it's all to get to this opportunity where maybe we can have a chance of like adding to our family.
Everyone like talks about the shots and everything and being so bad, and I felt like they weren't that bad. Maybe it's because I have a little bit extra cushion. I don't know. But
you're just tough.
because we would maybe there were a couple of times when we were at like a family reunion in the summer at like 2 hours away from home, and you don't think about these things normally. Like you wake up and you go to activities, and we realized we need to kind of like coordinate when we would be around the medication, which needed to be refrigerated. So
he may or may not have had to give me some shots in a barn. I don't recommend that.
I had to ask for my great uncle's access to like a utility fridge, just to be able to pull it off, so to speak. So there are things like that that are kind of sometimes an interesting challenge.
It definitely can take over components of your day-to-day life in ways that you can't even begin to expect it to. Like, how do I fly with these medications? Is TSA going to take my needles away? How do I store it when I get from point A to point B? Or, where do I need to be for my monitoring? But I'm glad to hear that it wasn't like the worst thing you've ever been through in your entire life.
No. And I mean, it's such a short window. I think I always thought that the whole IVF process was a lot longer than what it was. But like the shots itself, I think was it's like two and a half
2 weeks.
And the whole from like start to finish was like 3 months. I was actually like, oh, this is not
terrible.
No, not at all. And the 3 months was because I think we had to take a month break.
We were in that group of people who just hadn't even seen a pregnancy. So when we got the phone call that her blood test was positive, like that was just an absolute like turn the page moment. Like now we've gotten this far, and like what kind of opportunities and possibilities are now open to us that we've got the double line and positive pregnancy test. Just crossing into that progress was such a huge moment for us. It was unbelievable. And then to now go through each of the check-ins and just having our 20-week and everything looks normal so far. Just basically seeing more of these and like,
oh my goodness, I love it.
Yeah, like it's really, really hard to kind of really put it into words because we're still in the journey, so to speak. It was hard when we graduated because of all the memories attached to the journey. down to the day that we had our retrieval. I don't know but I remember that we were sitting in post-op or whatever, waiting for you to come in and explain some things to us. And you came in with a different number of retrieved embryos. And there was kind of not like a drastic, but a bigger difference. And we were kind of playing the probability game in our minds. And we were like, not going to like, maybe a little kind of like worried that the number we were given was a little bit smaller than we had hoped. And when you came in, you gave a different number, and then it was like, oh, there's like a question here. But then I remember you were already trying to address that reality of the smaller number. And here's some options. Here's what we can do. And that, which we super appreciate. It was a tough moment for us. In the moment, it was kind of hard to get that news. It was a smaller number. And then I remember we were leaving. We're getting ready to get in the car, and I'm, as like Karlie's husband, I'm like, how do I talk to her? How do I keep her excited when I'm also feeling a little down? And then all of a sudden I hear you yelling my name behind me. And I turn around, and you wear those like Swedish clog things or whatever.
Yes.
You're like clacking all across the parking lot. And you're like, Zac, and I turn around, and you're like, it was this number. It was the higher number that we had hoped that it was. And I was like, you got to come with me. You got to tell Karlie. And Karlie had already closed the door for Karlie. And then I opened it back up to you, arriving to be like, this is the number. And it totally changed how we felt. I mean, we would have faced whatever number we needed.
We pulled away and cried.
Yeah.
Oh.
And to be fair, it was still a good number. But again, it was just in the moment of like trying to balance all these things, just another level of this journey. And like just having you be somebody who, you could have just sent us an email or gave us a call on the way back, but you tried to catch us and give us the news. You must have known that it was something that would have helped us and elevated us, and it was huge. And
I appreciate that.
Yeah.
I'm glad you got the visual of me running in my click clack clogs, and I don't have that on video for posterity because I'm a little mortified to think of what that must have looked like. It's been such a fun journey, and it's such a pleasure to get to know you. And I consider you lifelong friends. I expect to hopefully hear from you down the road. And
we felt spoiled. Like throughout the whole process, took really incredible care of us. If we had questions, we always felt comfortable asking, and we never really felt like lost at any point. And it's just such a huge adjustment for us when we finally were able to be successful. And we're just hoping everything works out, and just didn't feel overly anxious because we always knew how accessible you guys were.
Like coming to RCC was such a like night and day difference, because like you were in almost, I think, 99 of all of our appointments. It was just like there was so much care put into every appointment at RCC. Like all the nurses, like even like the front desk staff were so nice. I like love them. So it's just the environment is so amazing at RCC.
what would you share with people that are contemplating either a first consult, kind of getting in touch, coming out of that kind of, I hate to say the word, but like a silent shame, or for someone that's like trepidatious about starting treatment and trying to figure out, do I keep trying or do I do treatment?
I think it's so personal, but for us, we often say like, we wish we had started sooner. Because you don't really realize how long of a journey it can sometimes be. But I think there's no shame in at least coming in and getting checked out and just ruling out some of those preliminary things. And I think if anything, doing that gave us a lot of comfort to move forward and know like what direction we should go, rather than just kind of sitting in this state of limbo. And because it's so hard each month when you're trying and it comes back and you're not pregnant, it's devastating. So it's like, well, once you actually start moving forward, I feel like, oh, I'm doing something. I'm actually taking some action, and there's comfort in that, at least for me.
I would probably say like that the world of IVF and like fertility treatments and the club of this group of people is way bigger than people know. Like kind of keeping with the theme of earlier in our conversation, like you're not going to go into a fertility clinic. There's no like hush hush, like deals in the dark kind of a feeling. It's like every conversation we've ever had as we've tried to like go and explore our options, it's always like there's a lot of different choices. There's a lot that's known about a lot of different things. It's not a perfect science by any means, but like talking with you, Dr. Maas, and other people, like they've seen this before, like, and they're going to help you kind of get situated and understand where you might sit in this journey, but it's way bigger than people probably think.
Yeah, and then just finding a good doctor that really cares about you and your partner and the growth that you want to have with your family, I think is really crucial because it's an important journey. It's an important part of your life. Your doctor is going to be a huge part of that. So you want to have someone who's going to be there for you and an advocate for you. I said it before, like it's personal to every person, but if they're willing, I definitely think it's worth sharing with friends and family that they're going through this journey because in general, just having people in our corner, like cheering us on, praying for us has been such a huge help. You can't do it on your own.
I agree. I think we have such an amazing support system around us, and you shouldn't do this by yourself or just between a couple, because I feel very confident that if our results had been different and if we were still on the hunt for our first pregnancy, the group that has been around us would be just as supportive, and we would be able to feel support. And if we were working with you guys, we would know that you would be giving us as much information as possible, that we would have like both professionals and just like your core people in your corner to help you navigate these things. I think my thing would just be a plea, like, don't do this, don't try to do this by yourself. Like, find somebody who you can talk to, and obviously talk to a medical professional, because they can give you answers that you can either take action on or take comfort in, or again start to find out what those limitations are so that you can start working on that. And
Well, I think you guys are opening that door and sharing your journey and really helping people feel more comfortable sharing their own journey. So kudos to you, and thank you so much for sharing your journey with me and for sharing it with everybody out there. I think you are doing more good than you know.